to Rob Kiltz, seeing my fertility live. I'm in the office by my office fireside chat. So, hello, hello, hello. I'm hoping this seeing my fertility Instagram works this week, and our Facebook and Instagram all works right. We'll see if anyone shows up. I was having a little bit of challenges on one of them, but we'll see if it gets going and working right. Can you guys hear me all right? Again, always a pleasure to be checking in and talking to everyone on the Fertile Fireside Chat. Let's see. I'm not seeing anyone on the Facebook yet, so I don't know if I'm having my challenges on something today. It says it's live. Let's see if I got my comments open. Yes, banners, comments. All right. Jay hi, how you doing? Okay, so Facebook's working, Instagram is working, great, loud and clear. Thanks, blooming hope. We have to have hope, hope, hope. And sadness does come in our world. And this loss of and struggle and stress of the fertility journey is really hard. And we're hoping that everyone is recognizing through the stress and strain, we're all able to connect together and listen and learn together. And everyone be listening and learning for the stresses and struggles in our team, in our team, your team, all of our patients and everyone, because when depression and sadness sets in, it's very lonely. And I know personally I've suffered from sadness, depression, and suicide in families and loss and all sorts of things. So we really want to continue to reach out. And the Fertile Spirit with Danielle and Christine and others and Fertile Hope Yoga, we really, really have to be putting it out there every single day in every way. So again, Leela, Michelle, Jaylyn, hello, Nahid, Jakyeb, mini IVF, good for poor responders. Okay. So in vitro fertilization, and I've been talking a lot about mini. I'm the mini guy. Mini is what I've been talking about so much. And I think mini is the home run personally for everyone. Mini for me and my recommendations for our CMY fertility clients, and you can talk to our even our nurses. I want to do mini. Mini is for me 10 of letrozole, 200 of gonal or follistim, and 20 of HCG. It could be 125 to 150 of gonal or follistim plus 75 of Menopur. That's another way to do it. But I believe if you're a labeled diminished ovarian reserve, poor responder, mini protocol, IVF is the same. We monitor you, we trigger you, we retrieve eggs, and ultimately, I've seen it make as many or more eggs. I've got PCOS, which are typically high responders doing well. Our standard dose typically has been 300 units of gonal F or follistim, or 225, 75 of gonal or follistim plus Menopur. But I found that it really works well. And I'm working to get all of our team members speaking the same language. Low dose mini protocols will equate them very similarly, by the way. So the letrozole or Clomid, 10 of letrozole or 200 of Clomid, I like the letrozole better, plus 200 of Gonal-F follistim or the 150-75 of Gonal or follistim plus Menopur, and the low dose HCG works really well. I do these a lot in serial stimulations, duo stims and triple stims for banking cycles. I even do these for people doing intercourse and IUI cycles, but sometimes I'll lower the gonadotropins to the 100 range. But it really works so well. The more and more we talk about it, I think it's a home run. I really don't like to see the 450 to 600 units, but I would say low to mini is 200 of gonadotropins. Standard is 300 and high is 400. I really, really think that's the sweet spot for so many. DOR, Brittany, yes, I think it's good for everyone. Now, again, this isn't cookie cutter. What we're finding is that less is best for so many. So the more we kind of lower the doses, reduce the doses, I think we'll see a lot better. Hey, Mercedes, Dumondry, Sema, Colorado, normal 5-day embryo after 6 failed cycles. I don't have history of endo, just thin lining. What do you recommend for trans or ERA? So a great question. Many failed cycles. Don't forget that inflammation is the cause of either bad sperm, bad egg, and a bad embryo, or a good embryo being rejected. Laparoscopy, laparoscopy for endometriosis. That's going through the belly button, looking inside, identifying if there's scar tissue or endometriosis that can be vaporized or excised. There's a medical treatment for endo, by the way. Endo is intra-abdominal pelvic inflammation. It's silent. And when I say silent, meaning that fertility isn't silent, is it? It's screaming at us, right? And so the more we can realize that it's screaming at us, it's not silent. But the other is to do 2 months of Orilissa or Lupron with letrozole. I like the Orilissa oral 200 plus 5 of letrozole, both oral, for 2 months. And then there's the antimicrobial and the antihistamine protocol, and adding some human growth hormone can be really, really helpful. Keep it simple, minimize the process as much as you can. And Kiltz's ketogenic fertility lifestyle, new journal coming out, really, really kick-ass change, in my opinion. Whether you're vegan, vegetarian, Mediterranean, pescatarian, paleotarian, or carnivarian, it really is add fat and reduce the frequency of your meals. Go to 1 meal a day and cook the carbs well. You want to micronize them and simplify them. It really helps. But fasting is lasting and the best way to fertility, which is 1 meal a day. So these are all anti-inflammatory. Don't forget intrauterine PRP weekly with the low-dose naltrexone, CBD oil, and omega-3 fatty acids. And we do sell them through our molecular fertility. We're working on some new lines and really, really helpful for everyone. So we're just sharing some ideas that will help improve your fertility. I really believe that the ERA is good. Should everyone be doing it right away? I don't think so. It's not necessary. But if you wanted the everything, talk to your OBGYN about laparoscopy, hysteroscopy. I think those are really important things that can be very helpful for you also. How's everyone doing on this beautiful Sunday? It's a little overcasty in upstate New York, and it's always a gratitude attitude from me to everyone, and we all need love and support. Our mental conditions are really, really very fragile. So we want to know that this infertility journey is hard, and we need emotional support. Our Fertile Spirit new website, Danielle and Christine are helping on that. So it can be very, very helpful for everyone. Let's see here. Portia, let's see, 33 retrieved, 12 mature. Was it the protocol? Did I trigger too soon? A very healthy damaged fallopian tubes, reason for IVF. Okay. So your damaged fallopian tubes, thanks, Portia. Your damaged fallopian tubes are secondary to inflammation. It doesn't just damage the tubes, it damages the ovaries, the uterus, and everything. So the protocol, I believe that's a good protocol. But if what you didn't do so well, then it may be, hey, let's push it a little longer. Let's add a little bit more, maybe human growth hormone. Look at something different. Are you doing something like a anti-inflammatory dietary protocol? Kiltz's lifestyle for fertility, again, for vegans and vegetarians, it's still 1 meal a day, add some fat, whether it's olive oil. I personally think for the vegans, the coconut oil is really the best one. For the vegetarians, if you can do butter, cream, and eggs, that's good. Reduce inflammation in our bodies. That helps. Add human growth hormone. Do an antihistamine, antimicrobial protocol for 30 days. And it might be something to look at endometriosis. But I think that listen, fertility isn't like I got 30 follicles, I should get 30 eggs and get 30 embryos. This is the mystery of this process. You get 30 follicles, you get 20 eggs, you might get 10 embryos. This is the unknown part of the process. We cannot promise you 30 eggs, 30 embryos, 30 follicles, 30 eggs, 30 embryos. It doesn't happen. But if what you didn't work so well and you think, oh, but more eggs is not better in this business. That's why I recommend the mini dose protocol. If you want to do a little higher, go up to 300 or 400 gonadotropins. I think that's something else to look at. All right. Since I missed my Instagram last week, thank you very much. Melatonin, Nirvana Baby. I think the melatonin can be helpful. I think laser and light therapy, Dr. Luthringer is bringing an intravaginal laser therapy, which is essentially a light therapy to help with reducing inflammation and increasing blood flow. We really believe that so much of what we talk about, our new family building guide is out. It should be on Amazon very soon, or our website, for a very nominal fee, which is really helping us get more and more and keep our IVF prices low. That's what we want to do. We're hoping to be in Sarasota later this year, Florida, and also in Miami. We're working on that, working on getting our Colorado team rocking and rolling in so many ways. Hey, Sherlyn, how you doing? Robin, good morning. A good Sunday morning to everyone, by the way. It's our pleasure, by the way. 34-3. Wow. There's so many success stories, but there's a lot of failures and hardness and depression and sadness. Let us all work together to have the quick hotline. I'm really struggling with this process, and we all are a family together. And I cannot promise that it's going to be easy or you're going to get the baby in the way you thought it's supposed to come. But the more faith leads all things for all of us, by the way. And Atlanta, we're working on Atlanta also. Gabrielle, absolutely. Dr. V, awesome. We're so grateful to her and the team. We're going to be working on some more team growth at all our locations. Leah, do you recommend sonohistograms for your unexplained infertility patients, even if they have had a normal HSG? Okay. Unexplained infertility is like every other unexplained disease. It's caused by inflammation. If you haven't looked at our keto lifestyle or fertile feast, you must go to Amazon. It's a crazy story. I didn't believe it until I personally did it. But I do recommend the saline sonogram. Also, I recommend hysteroscopy. I recommend laparoscopy. I personally believe we're missing the boat. The boat is simple. It's by my brain for a second, by looking diligently for all evidence of inflammation, but ultimately we're treating it, because if you're infertile, you're inflamed. You have infertility, you have hypertension, you have thyroid dysfunction, you have IBS, you have diabetes. No matter what disease you have inflammation. Unexplained infertility, you have something wrong. It's not unexplained, it's inflammation. And if you haven't read my book on the 5 causes of inflammation, it's a game changer. The 5 causes are simple. It's glucose, too much, plant antigens or other bugs that have very inflammatory processes or particles in them, like the COVID virus. It's the phytochemicals, fermentation in the bowels, and it's exercise. I know. I don't make sense, do I? Again, thank you for joining us on this beautiful Sunday. Really excited to be sharing our thoughts and ideas on how we can all make our lives more fertile. And my new book's coming out, Living Your Best Life, but I have my daily intentions and inspirations on Amazon. Check it out. But most of all, every day, thank you, God, Lord, Creator, for the day. Whatever we can bring to this fertility journey, it's a struggle and stress, but that's like putting the iron in the fire to strengthen it and harden it after we're able to kind of manipulate it a little bit. P.S. Mama, 3 failed transfers using all add-ons. Should I do no add-ons? Well, Sometimes now, so what? Have you had a laparoscopy, hysteroscopy? Have you done or done the 2 months of the anti-endo, antimicrobial, antihistamine? Are you doing Kiltz's keto lifestyle? Again, whether you're vegan, vegetarian, Mediterranean, pescatarian, paleotarian, or carnivarian, one meal, one snack, add the fat, cook the carbs well to micronize them, and lots of naps and mindfulness. I listen to books, I read books, I write books, infinitely sharing stories how we can all improve our true health and wellness in amazing ways. And please share these stories with your family members, your friends, your neighbors, your strangers, all right, around the world. We want to continue to help people get pregnant naturally. Talk to your OBGYNs. This crazy Dr. Kiltz has this idea that keto is good for us. Well, again, this label keto makes us run away and get scared. I was talking to a nutritionist the other day. She wanted quotes from me on superfoods that are helpful for women and men. My friends, there are no such things as superfoods. We've been super fooled in ways that we don't understand. No disrespect to all those nutritionists and writers of superfoods, but we've got it wrong. All right. Got 2 PGT normal embryos, XOXO, tinsel, hugs and kisses. What can I do to maximize my chances for implantation? First time transferring. Faith and food make fertility for all of us. Always lead with faith. Look at our family building guide. Go to our website about the immune 1, 2, 3, and 4. It may be IVIG, Humira, lipids, Lovenox, Neupogen, Plaquenil, prednisone, or more, but sometimes it's very simple. But what I find for so many people that are doing IVF unexplained, they get normal embryos and then they either don't get pregnant or they miscarry. It's because they've missed the true cause of their infertility. It's not their embryo. It's the environment within their pelvises, men and women. Men, molecular fertility male, women, molecular fertility female, ovarian bloom. We have some new stuff coming out. And don't forget low dose naltrexone. If you don't have it, tell our team I need the 3 milligram of the LDN. I haven't had it yet. So many people, if you would like add-on testing for some reason, we'll do all the reproductive immunology testing. Be glad to do it. And I'll be glad to review it with you at a charge, obviously. But I can tell you, I don't need the testing. I already know what's going on within your body. Unblock its inflammation. All right. Let's see. I am Tiki Amor. Hi, Tiki Amor. Can you unblock fallopian tubes with moving inflammation? Absolutely. We can treat inflammation, reduce inflammation. We do reduce redness, swelling, pain, increase better blood flow, and improve function. Cancers can resolve due to therapy of one way or another. A lot of the therapy today for is immunologic, right? And antibiotics or Humira or other medications that are anti-inflammatory. Yes. So I've seen fallopian tubes open up. I've seen pregnancy happen, just like we get such swelling all over the place and we can't move our joints and it's not moving. But then over time it heals, the body comes back, and at 65 in less than 2 weeks. I've never felt better ever in my life. I used to have terrible bowel bleeding, arthritis, psoriasis, kidney stones, migraines. I am a little ADHD and I still carry that around pretty readily. I know. Hey, Maria. Let's see, Maria, I did get a couple of calls or text messages this last week, and some people do get my number and text me. I'll put you in my system and get you in there. But if you fail to get me, scream out to me again. I've been nonstop since the Christmas holiday. I'm going to take Wednesday, Thursday, Friday, Saturday, and Sunday off. I'm going down to Sarasota to map out our next project. I'm working with our team. We're hoping to add some more practitioners that we're teaching our new ways. The more and more each of us and our team really understands the CNY fertility way. It's what you put in the mind and the mouth. It's reducing inflammation, stress, and strain. but you can't eliminate it, because without it, you wouldn't move. You just lie down and scream and die in some ways. But please, thank you. Even though you haven't heard from me, don't give up. Tia has to scream at me a couple of times before my brain even acknowledges. They're not screaming. I didn't mean it. She's amazing. Takes good care of me. I'm a blessed and lucky guy, by the way. Elizabeth, AMH is low, probably going to be suggestive donor eggs. There is one doctor besides Dr. Kiltz is willing to think outside the box, and he's done a lot with older women, even to Dr. Check. Jerome Check is awesome. Absolute love him. Dr. Chang worked and trained with Dr. Check, so he's an awesome, amazing doc. I've seen so many by going to Kiltz's Keto Lifestyle. Again, vegans and vegetarians are welcome. Absolutely. One meal, add the fat. It's fasting, fasting, fasting. That is what reduces the inflammation in the bowels, which it reduces inflammation in your entire body. My job is to help all of us understand what we've been taught about most of Western medicine is wrong. I do a ton of low dose protocols, mini dose, human growth, the antihistamine, antimicrobial, and the anti-endo, and the human growth for like 2 months. And massage, acupuncture, meditation, prayer. And don't forget, put up on the wall your paintings, your pictures of babies and family and love. Sheila, boy, I forgot Sheila's last name. Applegate just did something. I think it's Soul Livity TV, and we're all looking for someone to inspire us and help love us. But the best way that we can all love us is to love each other. And the more love we share in this fertility craziness, the more unfolds. Gina Rivera, what do you think of the results of Receptiva DX? If it says yes, it's pretty good. If it says no, 20% of the time you still have endo. My general recommendation is treat the endo, either laparoscopy and hysteroscopy, but hysteroscopy alone will not tell you if you have endo. It might tell you if you have inflammation, but my belief is that the inflammation in the uterus is in the tubes, the ovaries, the pelvis, the bowels, the brain, the skin. Every nook and cranny of our body suffers from some inflammation. The best thing you and I can do, one meal, one snack, one nap, infinite meditative mindful moments a day. Love, 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 faith, and kindness. And I practice this every day because my brain goes to, no one loves me. Oh, no one likes me. And you're so mean to me. And this isn't fair. But ultimately, God is always working in our favor. The three magic words, if you haven't read U.S. Anderson, amazing. The Fertile Secret by this guy Kiltz, or The Secret by Rhonda Byrne. Jump into this stuff. It's radical. Now, remember, I'm a Western trained physician that still operates a tremendous amount and does a lot of Western medical treatments. I wholeheartedly believe in what we're doing in the Western medical world. We need to be sort of a global or a blanket approach, meaning that pick from all areas. I think it's really helpful and important in this. Jessica, how many medicated natural cycles would you suggest before seeking IUI? How many times you do anything is your choice. We provide the menu, you pick and choose. 3 to 6 do's in this business may be reasonable before you say, you know what, I want to move on to IUI, or I want to move on to IVF, or I want to look at donor eggs, or I want to look at donor sperm or donor embryo or a surrogate. We do surrogacy, donor eggs, donor sperm, donor embryos. We are here to help you in the magic mystery of this process. So it really is up to you. It might be you do no intercourse or IUI cycles, you go right to IVF. You may choose PGS, PGTA testing. I don't recommend, we offer, and based on where you are and what you'd like, we'll get you there. PEMF along with IVF. Nicole, I'm sorry, my brain doesn't always get all these PEMFs. So if you maybe ask that, I can help on that. Let's see. Angel Elizabeth. Keto technically and paleo are high fat, low carb, low protein diets, in my opinion. They're medical labeled terms. We should kick them out. The human Ferrari diet is a live it plan. The live it plan, in my opinion, is eat less frequently, more like a carnivore than an herbivore. But again, you don't have to eat any meat, by the way. You can be a vegan, vegetarian, and I honor and humbly support everyone out there with their belief systems. I might throw out some stories, but just give the story a moment to understand the why part of it. When you eat 3 meals a day or 6 meals a day, you're filling your bowels with glucose, and your glucose is exposing all of your blood and your all of your system all day, all night. That's the deadly part of that. But if you eat only one time a day, with you have plenty of calories to maintain. Remember, if you're overweight, as we label it, you have some weight to use. But if you're lean and skinny, well, then you have to keep the calories coming. If you're not getting enough, it's because you're eating too many low calorie, and low calorie basically is you're not eating fat. Let's see, Colorico. I'm sorry if I mispronounce anyone's names. Dyslexia, ADHD, but I'm working on it. My follicles grow between my last scan on Friday and retrieval on Monday. So typically from trigger to retrieval, they're not going to change very much. So it's the trigger shot that kind of says, okay, we're now going to get you plump and release, but before we release, we do the retrieval. So we don't necessarily see very much. Thanks everyone for joining me on Facebook. I'm not sure my YouTube is working right. I got to work on this a little bit. So maybe our connections aren't perfect, but we'll get them out there. Hey, Christiane, how you doing? Nice to see you. Take care of these babies, and we're loving the hard work, emotionally, physically, financially, that everyone's going through in this process. We'll continue. If people need payment plans a little longer, we'll do our best. But remember, we need the energy flowing so that we can keep providing for everyone. Can someone who had RPL do the microbacterial protocol? I do recommend the immune protocols, which include the antimicrobial, antihistamine, the anti-endo with a little HGH. Don't forget our molecular fertility supplements. Really, really, really helpful in that. So again, love to all you guys, and grateful that all you guys are joining me. All these amazing fertility doctors out there, honor to all of them, by the way. We're all providing somewhat of a little different language, but ultimately we're working for the same destination. Let's see. For us, IUI didn't make sense at all. It's expensive down here. Lesbians have to buy sperm too. 8 to 10% success after 7 tries success. 2 to 3 IVFs. Yeah, I agree. Elizabeth, thank you. We do a tremendous amount of IVF for lesbian couples, gay couples, that sperm or singles, whatever you are, transgender, whatever. IVF, as long as we can really maintain its affordability, access, and quality, it's going to be a home run in so many ways. Let's see, Gabriela. Block tubes is told due to having ruptured appendix and setting up gangrene 14, having saline sonogram Wednesday in Atlanta. Will I also have to have a laparoscopy, hysteroscopy? Not necessarily. I do often recommend the hysterosalpingogram so we can get a good look at the fallopian tubes. If they're hydro, we should think about ligation or removing them. But sometimes we can't do that. But this is where I recommend a 30-day antimicrobial, antihistamine, and the anti-endo protocol. I think can be very, very, very helpful for everyone. Thanks for sharing and joining. We're getting shared to our YouTube and Facebook and Instagram and TikTok, and really sharing a lot out there on all these social formats, so we can really help share the word, affordability, access, but even if you're trying naturally, we have a lot of great information regarding inflammation, how to reduce it on your own. And you don't even need the doctors. Put us doctors out of business. That's my motto in life. I've learned so much. Let's see, for some reason, let's see what's going on with, I may need to restart my, hold on a second. I don't know if you guys can hear me on my, let's see what's going on. My camera froze. Let's give it a quick, let's see what's going on with OBS. For some reason, let me go here. We'll do this one time and see if we can get this going. Give me 1 second, guys. I apologize. Oh, I love this stuff. It's all technical, right? We're going to end our broadcast